Liz, welcome to the show. How are you doing today?
I'm doing great. I'm excited to be here.
And that's awesome. Hey, Liz, let's jump into this and get started just by telling listeners just a little bit about your incredible journey. What inspired you to move from emergency medicine to medical innovation?
Well, it's an interesting journey because it wasn't anything that I did necessarily intentionally. So I'm a board certified emergency physician, was an academic doc at the University of Maryland, and kind of happily going along my academic emergency medicine path. But when I was a resident, before I became a faculty member and I trained at GW, I was really struck by the number of people who showed up to the ER for nosebleeds. And
Oh,
if you
nice.
talk to any ER doc, you're going to hear them kind of moan and groan when it comes to epistaxis or nosebleeds because it's a lower acuity problem, but one of the more cumbersome and difficult things that we take care of. And believe it or not, we see 500,000 ER visits a year for nosebleeds.
Wow.
Yes. And I just couldn't believe people would show up to see me and wait hours over such a simple problem. But I found a lot of people tend to mismanage their nosebleeds and often do things that are not helpful, like putting their head backwards instead of forwards or pinching their nasal bridge instead of down over their nostrils. And most importantly, they don't hold constant pressure. You need like 10 to 20 minutes of uninterrupted pressure to stop a nosebleed. Sounds simple, nobody does it. Really
Hmm.
hard to pinch your nose. And then nosebleeds are actually really common in younger kids, 2 to 10, older adults, 55 to 80, who might be on blood thinners. So it's really like the least likely population to manage it well. So I think they panic and they show up to the ER and they're like, you must see me immediately because this is, a nosebleed emergency. I'm bleeding. But for us, we're like, you didn't just get shot. You're not having a stroke. So you have
Hmm.
to wait.
Yeah.
So my frustration as an ER doc helped me kind of create this new nosebleed treatment device called NasaClip that provides external pressure with intranasal sponges that can be medicated, sized for both adults and kids, and it's kind of like the Band-Aid of nosebleeds. So it sat on the back burner for a long time, but it was literally that I kept seeing nosebleed patients all the time in my clinical work, and I was like, man, I've really just got to get this thing to market. So I finally kind of buckled down in 2020, started fundraising, and after raising our first about million in capital, we were able to enter the market in late 2023. And now we've been in the market over a year, raised about 3.75 million for the company.
Wow.
And it's taken off in ways that I could have never imagined. So now I'm a full-time CEO, startup founder. And it's been a really exciting journey and something that I often tell physicians to consider early in their careers as like a way to always look for those little things that might be annoying you that actually might be the best next innovation in medicine that both helps bounce your career and also improve the lives of patients. Practicing medicine truly is an art form. Certainly, being an innovator and founder is definitely an art form. And there's really no defined path for anybody who goes on these journeys. And for me, it was something where I was completely off the path of traditional medicine and certainly venturing into a place where I didn't have as much experience. But in some ways, that can be valuable because you're not afraid to make mistakes. You're really willing to take risks that can be valuable in the long run. And you're able to kind of go through something, understand if it doesn't work, we're going to pivot and move on to the next thing without getting kind of too caught up in the momentum and expectations that maybe someone has if they've been in the seeped in the kind of entrepreneurial and business world for a long time. So in many regards, I think I was told that emergency physicians in particular are great startup founders because we're really used to dealing with a lot of what startup founders have to deal with, which is being resource poor,
Hmm.
which is what we deal with in the ER, having utter chaos going on at all times, being a really good read of people, which you need to be as any doc, right? But especially in the ER when we have short time and we need to kind of go into a patient room, decide what's going on, really infer, is this a sick or not sick patient and what needs to be done. Um, and then also kind of being able to ride those highs and lows without getting too off kilter. And those are all things that are where I was very prepared and used to doing as an ER doc. And I think really set me up for success as being a startup founder. The first thing is you need to make sure it's unique and novel and protect your IP, your intellectual property. So that means you need to do a patent search. And if you're really seeing that there's something like that, you're going to probably have to come up with a little bit of the dough needed to protect that, because in the beginning, the only value your company will have is the intellectual property. The second is what I mentioned with my experience doing the iCore. You need to make sure you have good product market fit. So before you pour your blood, sweat, and tears into something, take the time to really explore your market, do customer discovery, and make sure that you have something that once it gets to market, somebody's going to actually pay for. Because a lot of times it may seem like a great idea to you, but if you haven't really done the work to validate that market, it won't work well. And then I would say outside of that, the third thing you need to do is start understanding what resources and team members you're going to need to bring that idea to fruition. For me, I had a co-founder who was actually an undergrad at the time I was in residency, that then went on to doing a lot of work in the startup space, had worked with a couple of companies that had very successful businesses and potential exits. And that really gave me the lift I needed in having someone who understood the business side of a startup, whereas I kind of was the person who was really driving the innovation and the ideas. You need someone who's still going to drive the business. And if you don't have that or you can't learn it, then you got to fill those gaps. So know where the gaps are on your team and bring that in. And that also means obviously the engineering, everything else that you have, and pick strong team members. I listened to a really awesome podcast that I would recommend to all your listeners called Founders by David Sindra, and it really goes through the biographies and autobiographies of really successful entrepreneurs and founders throughout history and even present day. And a lot of times you'll hear them talk about in the beginning, you got to have an A team. You got to have like the best people you can put around you. And that was certainly very integral to my success. I really do think it's important because in many regards, this is a marathon, not a sprint. I mentioned like how long it takes a lot of founders to really be successful, and you only hear about the story once they've passed that, threshold of an exit or a big success story. And you don't know all the backstory and the long hours and the grueling years of kind of up and downs that are required to get to that point. So for me, I try to be, first of all, I'm not afraid to ask for help. So there's a lot of things in my personal life that make it possible for me to do this. I have a live-in nanny. I have a mom that's really active with her grandkids. I have 2 of my 3 sisters in the DC area. We really lean on each other. And then I also look for support from, the ecosystem, especially in Maryland, which has been really focused in, I think, investing in the startup and med device ecosystem. I have other med tech founders who I talk to. I have groups, especially for female founders, because we have a unique set of stressors and challenges, especially when it comes to fundraising. And, I make sure that I have fun while I'm working. So a lot of times when I talk to my residents, one of the things I really emphasize to them is it's really hard to be successful if you're not happy. And so you really need to make sure that you're taking care of your personal wellness, whatever that is. If it's living in a place that's warmer because that makes you happier, if it's being closer to your family, if it's making time for activities that kind of fill up your cup, you have to do that because it is going to be harder and longer for you to get to where you're going if you're miserable while you do it. And so I want to be able to enjoy my life and not only show my 2 daughters that I'm this, brilliant, successful physician innovator, but that I also was a happy person, a mom that loved spending time with them, and that I was enjoying my life along that journey and that grind, towards the destination that I want, which is a successful exit for NasaClip. We are getting ready to launch on Amazon in the next couple of weeks, which is also a huge milestone for me, right? I think,
Congratulations.
thank you. We have a reusable version of our device I mentioned where the sponges are replaceable. That should be coming out in March. And then we're really working on building our revenue this year. And then in addition to that, I mentioned we just submitted a grant to NIH to look at NasaClip as a drug delivery platform. So, I think that's going to be a necessary and really exciting step towards the $1 billion exit that I want. And outside of that, I think you can look to see me as a future physician innovator that's going to be a well-known example to other mom docs, women of color in this space, and especially just those founders who did not necessarily think that their career involved anything related to entrepreneurship, but then just blossomed when they got into that lane. And I want my story to really be inspirational to anyone who might be interested in this, and understanding that if you believe in yourself and you have the hustle and grind in you, you can make it and you can be really successful. And that's really what I hope that my story can serve to others. I think that you have to first make sure that you're going to create the time and not and understand that it will not always be a back burner project. Like at some point, if you're really serious about this, start putting the kind of safeguards in place so that you can have time for that transition, that pivot into being an entrepreneur. And it can be gradual, right? Because it's hard to just say like I'm jumping in, with 2 feet in the deep end and I'm just completely giving up medicine. A lot of us don't want to do that. We trained our whole lives to be physicians, and I'm here to say you don't have to do that. You can do it gradually, but you have to start making really definitive decisions that like this is something that I think can work. I believe in myself, and so I'm going to take really intentional steps to make that happen. Carve out the time to work on the project, dedicate the funds that I need to do that, and give yourself a timeline for you to be able to achieve those self and hold yourself to that so that it can be a reality.
That is amazing advice, spoken from somebody who's been through this process already. So, Dr. Clayborne, this has been a fantastic conversation. Thank you so much.